Well, okay. We've been working on a few technical things here, but I think we've got things worked out, and I have guests in the studio. I have guests on the phone. So let me find out, first of all, Matt Wenzel joining us on the phone. Can you hear us okay, Matt? Okay, hang on. Matt, can you hear us?
I can. Can you hear me?
Yes, now I can. I just got to turn you up. So, because I'm sitting on the control side here this morning, folks. So, but sitting on the other side in our guest studio, I also have joining us Robb Gardner and Kent Severson. So, late last year, the 7-member Henry County Health Center Board of Trustees approved what's called an expanded lease agreement with Great River Health. The two organizations have partnered on healthcare services offered in the county now for more than 10 years. I don't know if folks knew that or not, Rob. And Henry County Health Center's CEO, Robb Gardner, has said the expanded relationship is a great opportunity to continue to serve healthcare needs for Henry County. Also, as Henry County Health Center is owned by the county, this agreement needs to be put to a vote. The Henry County residents will have a chance in March to do that, and if finalized, Great River Health System will manage the hospital for several years. So, again, I have Robb Gardner here. I have Kent Severson, who's chairman of the Henry County Health Center Board of Trustees, and Great River Health CEO Matt Wenzel on the phone to discuss what this agreement means and how this is set up. And so, actually, I'm going to go to Kent first. We need to talk about why the partnership is being expanded in the first place, Kent. What promoted this or prompted this arrangement?
Yeah, thanks, Teresa. We've been working on something with this for quite a while now. And thank you very much for having us on the program this morning to explain a little bit more about it. We feel this is like the next step in a long-standing relationship we've had between Henry County Health Center and Great River Health. You mentioned that we have had a management agreement with Great River for about 10 years, and it has been very, very successful. We feel that they are a great partner. They have a great organization there. They care deeply about healthcare, and we know them, they know us. So we feel this is a really good fit, and we think it's going to help us to continue to have healthcare access here close to home. And if I may just take a second, I'm on the board, and if I could, I'd just like to tell the listeners who else is on the board. We have Bob Meyer, Jan Town, Carla McNamee, Sally Olson, Joel Protzman, and Carmen Heaton as part of the Board of Trustees.
All right, Kent. So the board made this decision to move forward now with what's called a lease agreement. What does that mean? Because people have kind of their own idea in their head about a lease, but what does this particular agreement consist of?
Well, basically, as you said, it's a lease agreement. But we will still be called the Henry County Health Center. The Board of Trustees that I just named will still be in place. But it's an opportunity for us to join forces more formally with a trusted partner, as I said, with a proven track record of strengthening local health care. The trustees are all residents of Henry County. We have families here. My family's here. I have grandchildren here, and I think everyone realizes how important it is to have quality health care in Henry County. I mean, it's just absolute a must, I think, and the trustees have worked on this many hours on this lease agreement, and we feel that because we know Great River is, as I said, a trusted partner, that we feel this is the way to go at this time.
So why do you need a partner at all? I mean, it's been a standalone community county hospital. Why at this point in time now do you feel like Henry County Health Center needs a good partner?
Well, as many of you might have heard, a lot of rural hospitals throughout the state and throughout the United States are finding some financial issues right now with the changing demographics. In our situation here in Henry County, we have an aging population. A lot of the folks that we see are on Medicare, Medicaid, so that percentage is increasing all the time versus the private payer. And we just don't get the revenue from that as we normally used to. Like I said, the percentage of the Medicare, Medicaid is expanding, and so it makes it a little harder for us to financially to be strong. Now, however, I will say we entered into this with Great River from a very strong financial position. Okay, the hospital is in no way, shape, or form in trouble where there's no chance of us closing. That's not why we're doing this. We're coming from this from a strong financial position. And we think that even though the demographics and things that I mentioned are changing, we feel that Great River can help us weather some of these challenges. Obviously, the coronavirus has also taken a toll on hospital finances. And, we hope that by approaching this way that, we can, we've been around for 100 years. We want to be around for another 100 years. So that's why we're doing it.
And in a moment here, we will also be talking to Matt Wenzel about Great River's side of this. But Rob, first of all, something that people are really going to be concerned about will be any changes at the hospital. So what could we possibly anticipate?
Yeah. Good morning, Teresa. Thanks for having us on. And, just as Kent said, the health center is celebrating our 100th anniversary this year. That's a tremendous accomplishment. And, over that time, the community has relied on us for those healthcare needs, and that's not going to change. I have been very fortunate to live in Mount Pleasant over 20 years, and the community has been tremendous for me and my family. And our patients and elders that we care for at the health center, there are friends, there are family, there are neighbors. And so it's really important to me and the Board of Trustees that we maintain that same trust and commitment to excellence that our communities just come to expect over those 100 years. So our patients won't notice many changes, except the possibility of expanded healthcare services. And as Kent mentioned earlier, that Henry County Health Center is going to continue to still be the name of the health center. The agreement's not going to cause any increase in property taxes. And all the property tax dollars are going to stay local, and it's all going to stay in Henry County. In addition, the Henry County Health Center associates are going to continue to be employed by the Board of Trustees, and that's real important to the Board of Trustees and important for our associates. The Henry County Health Center Foundation dollars are going to stay within the community, and the health center is going to continue to be owned and operated and staffed by Southeast Iowans who understand the needs of this community. And the other nice thing is we're going to continue to have the same management team. I'm still going to be the CEO, and the Board of Trustees are still going to have input on its budget.
Okay, so if everything essentially is staying the same, now from your perspective, why would Henry County enter into this lease agreement with Great River Health? Well,
just as kind of Kent mentioned, and we talked about over the last several years many times, Teresa, you and I have, and it's just about the challenges and all the changes that are happening in healthcare, rural hospitals, rural healthcare providers are facing those, and I think they're going to continue. Also, too, I think if we look at it, if those challenges are any indication of what might lie ahead in the future, our best response is how we proactively plan for the future. And this is an innovative public-private partnership, along with a long-term trusted partner who knows Southeast Iowa. And then by working together, the Board of Trustees and Great River Health are much better positioned to weather these challenges, face these challenges, and actually succeed with these challenges, that either one would be by themselves. And so this is the key why we have to do this. And this lease agreement also provides stability in critical healthcare services, such as EMS, finding a solution for EMS for our community for many years to come. And I know that's important for a lot of Henry County residents, and it's important to me, it's important to the Board of Trustees, and that's why we all need to vote yes on March 2nd.
You know, you've talked to the associates about this because, of course, they have major concerns about anything like this. Members of the community have been hearing about it. What have you been hearing back from the community and the associates? Yeah,
I'm very pleased to share the reaction to the decision. It's been overwhelming positive. Over the last several weeks, we've been talking with several people in and outside of the health center, our staff, local government officials, business leaders. Many have shared the appreciation that the Board of Trustees for being proactive and creating this innovative partnership at this time rather than facing further healthcare challenges independently, just as I spoke about earlier. And then if you look at our area right now, if you take a step back, we are creating investments in healthcare and higher education in our region. We're creating innovative public-private partnerships to drive positive change in Henry County and all of Southeast Iowa. And those partnerships are going to make a significant difference for years to come. And then, everybody recognizes the health center is a key part of Mount Pleasant and all of Henry County. And as I said earlier, if driving forward and going forward with this partnership, we're finding solutions to stabilize critical healthcare services such as EMS for our residents for years to come.
So let's go to Matt, and I think Matt's still there. We lost him again, Rob, for another second, but I think we've got him back now because we need to look at the other side of this too, and I'm guessing maybe some of the same reasoning is going to apply. Matt, why is Great River Health interested in expanding their partnership with Henry County?
Hi, Teresa. Can you hear me?
Yes, I can. Can you guys hear me
great.
over there? Yep.
We've been having some technical issues. So.
Yes.
So why we're interested is that, as Kent said at the beginning of this interview, is that we've been a partner for over a decade. We believe in Henry County Health Center and want to get closer together in the relationship. And the reason for that is all things that were mentioned by Rob and Kent. But for us, what's important as well as all of that is our vision. And our vision really is getting money, getting lives influenced, of course, at the base with our patients and our employees. But we have a grander vision. And EMS is a great example of that, is that we want to be able to impact people's lives across Southeast Iowa and not just in the four walls of the hospital. And we see Henry County Health Center, as they've been for 10 years, an important partner. And this will help get us closer, and we're able to have Henry County Health Center be part of our vision.
All right, so I know that Great River Health System does have some arrangements with some other organizations in the region. So is this one different, and how is it different?
It's a great question. It's very different, and the reason for that is because we listen to the board, we listen to Rob, who's representing very well the constituents and the employees there. So because it's a county-owned hospital and it will continue to be that way, we had to structure a deal differently. So it really gets to our philosophy of local control, and we see healthcare as being not franchise medicine. It's about relationships. And so you have to listen to the local community, the local people. And what was so important here is to maintain IPERS. And if it wasn't for that, we wouldn't have spent so much time, but it would have not been the right work. So we really took it a step back and developed this long-term lease agreement with the employees in mind, with the community in mind, and have come up with something unique and different because we believe that's what employees in that community wants and deserves. So
let's go back to Kent now. It was decided by both sides that this is something that Henry County residents should weigh in on, that they should have a chance to support the agreement. That special vote is set for March 2nd. Kent, what should the voters know about that vote?
Well, voting yes on March 2nd is really a vote to support the future access to quality health care in Henry County. And it means that our residents will determine the shape of local health care. You know, this is a critical time, as we said earlier, when rural hospitals are finding it more difficult to survive. And voting yes means we will be able to enhance services, as Rob talked about, and establish a long-term viability. And it'll enable us to focus on quality, service excellence, innovation, and being an employer of choice within Henry County. So, voting yes on March 2nd means we'll be able to make a great step forward, advancing healthcare and serving our residents for another 100 years.
All right. We'll talk more about this as we move forward. I know we've kind of hit the surface of this, but I'm sure questions will arise, and there'll be a need to answer those questions and address any other concerns or just general questions, right?
You bet. Anytime,
Yeah.
Teresa. We'd be happy to come back out and answer questions with you and do this again over the next 5 weeks. And, make sure our community knows that this is a positive step forward. And it's an exciting time. You know, people have said to me, Rob, what's your thoughts on this? And I stepping back, you look at it, it's exciting because we're being innovative and we're doing this from a position of strength where we can now really just the same thing the Board of Trustees have done over the last 100 years, create innovative ideas and then put them in place and find solutions to have outstanding healthcare for generations to come. And this is what this is doing. So I really want to compliment the 7 Board of Trustees. They've done a tremendous amount of time and effort, done their due diligence. Thanks to Great River Health for our partnership and really coming together to find a solution for Henry County, but also to all of Southeast Iowa.
All right. Matt, thank you very much, and thank you for your patience with the technology this morning. And I'm going to go out on a limb and promise this won't happen again if you want to join us again on the phone, okay?
I'd be glad to. Thank you for your patience.
All right. Very pleased to have in the studio Kent Severson and Robb Gardner, and on the phone Matt Wenzel. We've been talking about the proposed lease agreement between Great River Health Systems and Henry County Health Center. Gentlemen, all of you, thank you so very much for being
Teresa.
here.
Thank you very much.
Thanks. Have a good day.